In today's Health Smart, we are talking about World Lung Cancer Day coming up on August 1st.
Lung cancer is the world's deadliest cancer, and here to talk about the disease and raise awareness is Telly Award-winning thoracic surgeon Dr. Eric Presser, author of An Empowering Guide to Lung Cancer. Dr. Presser, thank you so much for joining us here today.
Thank you so much for having me again.
And what are some of the misconceptions when it comes to lung cancer?
So one of the problems that many people have is when they hear about someone who's diagnosed or even dies of lung cancer is they figure they're a smoker. They deserved it. And what most people don't understand is that up to 15% of lung cancer patients are in never or non-smokers. In the past 6 months alone, I've had a few cases where they were dealers in a casino. So they're exposed to secondhand smoke. And that is one of the misconceptions, is that people need to understand that it's not just a smoker's disease. If I told you that you had a 15% chance of winning the lottery, you'd be playing every day.
Now, you're talking about secondhand smoke, but you also want to talk about third-hand smoke?
So in my book, one of the things I do mention, because many people don't understand what third-hand smoke is. Third-hand smoke is the toxic cocktail that is left behind literally when the smoke clears. We've all been picked up in a car by our friend who just had a cigarette and threw it out the window. More importantly, we have a lot of people that smoke outside, and the toxins get all over their hair, their skin, their clothes, and then they go inside and they play with their children. Or they play with toddlers who climb up on them, and what do they like to do? They like to put things in their mouth, they touch them. So unless you're going back inside and taking a full shower and changing your clothes, you're actually exposing people to the toxins, and there is more and more research coming out that this is detrimental to lung health as well.
Wow. What are some other causes of lung cancer?
So obviously smoking is the most common cause and effect. We now know that 1 in 6 smokers will get lung cancer. If you do smoke, then you live 15 years less than non-smokers. Other common causes are radon, asbestos exposure, and secondhand smoke, as we mentioned before.
Okay, so what are the early warning signs people need to look for?
So the problem with early warning signs is that there really aren't any in lung cancer, because our body is so resilient that by the time you actually have that chronic cough that doesn't go away, or you're coughing up blood, most of the time you're already in the later stages of the disease, and resecting for cure is less. So with 85% of lung cancers being diagnosed at these later stages, we're looking for lung cancer screening. So about 3 years ago, we started to say the high-risk group, which technically is between 55 and 77, but that changes depending on who you talk to, and you smoked a pack a day for 30 years or 2 packs a day for 15 years, you should get a low-dose CAT scan of your chest to check, because we want to catch these killers early, before you have the symptoms.
Wow. Okay. Wow. All right, Dr. Presser, thank you so much. Appreciate it. Well, you can find more from Dr. Presser's book, including his book, An Empowering Guide to Lung Cancer, at ericpressermd.com.
Thanks for coming in.
Pleasure. Thank you for having me.
Good information.